It's been a year since USAID was shut down by the Trump administration. Thousands of workers terminated, along with more than 5,300 agency-funded contracts, some of which help fight deadly diseases around the world. Thanks for joining us. I'm Larry Miller. Thanks to the Pulitzer Center, I traveled to Southern Africa to answer two major questions. What's happened to USAID since it was closed? And what are countries that are looking for U.S. support having to do in order to secure it?
Finding tremendous waste, more than anything else, I think you could say. Probably fraud and abuse can be added to it.
It's really sad. An organization I care a lot about, that a number of my friends work with, and the cruelty is the point with this administration.
The closure of USAID came as a shock to the world and especially to NGOs, non-governmental organizations that depended on USAID funding. Started in 2003, USAID and the CDC used taxpayer dollars to study, treat, and prevent HIV and AIDS around the world, and particularly on the continent of Africa. Well, when USAID was shut down last year, that left many people wondering what that meant for the future of global health.
It was a very traumatic year. We got a notice on a Sunday evening, I remember, that we had to close our services the next day.
Dowie Nell is the executive director for Out LGBT Wellbeing, an organization that provides HIV/AIDS healthcare services to high-risk groups in South Africa. He said his organization received roughly $2.5 million in PEPFAR funds administered by USAID, helping more than 1,600 patients get life-saving HIV medication. That funding vanished in an instant.
So overnight, we had to deal with a lot of stuff, like how to ensure ongoing treatment for this cohort of clients, and sort of internal issues in terms of your staffing, closing down.
In a 2025 post on X, Secretary of State Marco Rubio addressed the USAID contract cuts. He said the 5,200 canceled contracts spent tens of billions of dollars in ways that did not serve, and in some cases even harmed, the core national interests of the United States. On its website, the White House lists examples of USAID-funded programs it says were malicious pet projects of entrenched bureaucrats. They include $1.5 million to advance diversity, equity, and inclusion in Serbia's workplaces and business communities, and $70,000 for production of a DEI musical in Ireland. Former USAID officials point out that some of the items listed required context or were programs run by other agencies. NGOs in South Africa say their health programs were anything but wasteful.
It is a bleak picture following the closure of USAID.
Since the funding cut, Nell said some of the more than 1,600 clients he was treating are now missing.
At this point of the game, we know 200 are totally lost. We can't get hold of them.
Health experts say patients diagnosed with HIV and AIDS require routine visits to check medication adherence and more. If patients fail to take their medication regularly, the virus could rebound and potentially contribute to new infections.
I thought that this is the end for us, especially for those who are positive.
One of Nell's clients, who we'll call Brian, has seen the drop-off in clients returning to the clinic since the funding cut.
They told me, what is the use of going there, because there are no longer fundings. Yeah, I did tell you, there are no longer fundings. That doesn't mean there's no longer medication.
In late 2025, some of the countries who received PEPFAR funds began announcing new memorandums of understanding, or MOUs, with the U.S. State Department. These new, multi-year agreements provided PEPFAR funds, but required countries to commit to specimen collection, data sharing, and access to sensitive information. Some countries, like Zambia, allege the U.S. State Department demanded mineral rights in exchange for funding. Rare earth minerals like cobalt, lithium, and copper are vital to U.S. companies looking to produce new AI-powered technology. Many of the minerals needed to do that at scale are present throughout various countries on the continent of Africa. In a statement, Zambia's foreign affairs minister called the proposed provision unacceptable, adding Zambia must have a say in how her critical minerals are used. We asked the State Department about the alleged mineral rights provisions. A spokesperson for the agency said there are not critical mineral provisions in any of the America First Global Health MOUs and no plans to sunset PEPFAR. We have prioritized continuity of care through bridge funding for PEPFAR and remain committed to responsible stewardship of the program. But while Zambia rejected its proposed MOU, South Africa hasn't made much progress in its talks with the U.S. PEPFAR funds administered by USAID funneled more than $200 million into its HIV/AIDS response, although a bridge program provided $115 million after USAID contracts were canceled. That deal expired last month. And sources tell me PEPFAR funds for some NGOs are now on a month-to-month basis for now. The uncertainty is contributing to its own problems. Dr. Linda Gale Becker is a leading HIV scientist and clinician. She's also the CEO of the Desmond Tutu Health Foundation.
It was only 1/5 of our program, but that 1/5 was providing counselors in the clinics, tracers to find people who had disengaged with treatment. The Western Cape, when I am now trying to implement the lenacapavir rollout, we don't have counselors in the clinic who would do choice counseling, for instance, who are doing the HIV testing.
And still to come on Aid Interrupted.
We still need more resources to make sure the spread is kept.
How an anonymous gift is keeping a mobile TB program going for now. Aid Interrupted returns after this. South Africa has been struggling to get a handle on a high number of tuberculosis infections, but they've been making progress in their efforts thanks to organizations like the Orem Institute. But when their USAID contract was cut, an unexpected lifeline provided renewed hope and spurred innovation.
We are going to initiate TPT in a community setting. Usually TPT is initiated in a clinic, but because of the congestion of patients, sometimes patients don't want to come. So what we do, our professional nurses get medication from the department and then they do initiations at the household.
That's Refiwe Mototo. She runs the ground operations for the Orem Institute's Pro-TB program. She, along with nurses and other professionals, goes door to door, testing and providing treatment for tuberculosis or TB.
Today we are coming just to assess them and initiate them on TPT. So here I have medication. As you can see, there's a different regimen for the children, which is INH. Also, I have a HIV test here.
South Africa is among the World Health Organization's high-burden countries for TB, HIV-related TB, and drug-resistant TB. Tuberculosis is a serious infectious disease that usually spreads from an infected person by coughing or sneezing. It is curable, but if left untreated, can be deadly. Tuberculosis is a leading cause of death in South Africa. Experts say it is prevalent because of poverty, crowded living conditions, and HIV infection.
So the lady, she has a hearing problem, but the husband will be speaking to her directly, or we have to speak a little bit louder so that she can hear. And then they've taken history, the lady's on ART medication.
For this Sarah Bartman family, the male partner is positive for HIV and TB, and his female partner is HIV positive and TB negative. Although she's testing negative for TB now, she's been exposed, and the Pro-TB team is giving her preventative treatment to ensure she remains negative.
Now they're going to make sure that she also stays on TPT until she finishes. But ART, she'll be on ART for life.
In 2023, USAID awarded the Orem Institute a $47 million grant over 4 years to research, track, treat, and prevent TB in 7 provinces in South Africa, referred to as high-burden areas because of the prevalence of TB cases. But the work came to an abrupt halt in 2025, a short time after President Trump was sworn into office. Dr. Priyashni Subrayan is Orem's technical director for TB.
You know, apart from being completely shattered and heartbroken about the work that we were producing, we had to kind of pick ourselves up quickly and try and figure out, what do we do next?
The Trump administration canceled 83% of USAID contracts. Secretary of State Marco Rubio alleged in an X post that the agency spent tens of billions of dollars in ways that did not serve and in some cases even harmed the core national interests of the United States. Dr. Subriam said Orem's Accelerate One program used their USAID funds appropriately and said there was regular oversight from USAID officials.
USAID was very strict about how you use your funding and how they monitor you, and then how regularly they come and visit you so that they can see you're doing the work.
The Trump administration has what it calls an America First global health strategy. According to a spokesperson with the State Department, the goal is to have clearer strategic direction, stronger accountability, greater recipient country ownership, and a sharper focus on results.
We have identified more than 60 TB cases now.
The USAID funding cut meant that Orem was forced to lay off workers directing the Accelerate One program and temporarily abandon its efforts to fight TB. It left thousands untreated and without monitoring for months. But help did eventually come in the form of a $1 million anonymous donation.
And we're not serving, within facilities like Department of Health. We're really going to the people who don't go to facilities.
That anonymous gift allowed Orem to restart its TB work in February. But instead of serving 7 providences, they can now only afford to serve 2. Orem can only rehire a handful of its workers it laid off as well. With limited funding, staff look for cost savings wherever they can. They collaborate with other organizations, and they run only 2 of their 3 mobile X-ray vans where they scan lungs for signs of TB to save on staffing and fuel costs. I also traveled with the team to Soweto. This man said he felt congestion in his chest. It got so bad he was forced to sleep on his side. He stopped by the van to get checked out.
What does it mean to have something like this come to your community?
He's very much happy for this because now Monday he has to go to the clinic and then to meet with the doctor for the interpretation of the results.
We've identified a lot of cases and we're able to put them on medication, but we still need more resources to make sure the spread is kept.
There's a sort of a devastation that the funding that you once had is gone, but there also does seem to be a relief too, that you have a bit more freedom in ways that you didn't have, and that because of that you can be almost a bit more innovative too.
Yeah, to come to think of it, you are right. I mean, they always say don't let a good crisis go to waste, right? And what this has clearly taught us is that if you only have this amount of funds, right, and it's limited, how do you maximize every single, dollar or cent to make this project last as much?
So minimize.
While they focus on the work, they remain hopeful for the future. The grant ends at the end of this year, and while no official determination has been made about an extension, they hope someone will step up to keep their community-based TB program going. The young ladies and staff at Stepping Stones International tell me the DREAMS program was making a real impact in their lives, keeping young girls empowered, informed, and away from older men that could potentially take advantage of them. But when USAID folded, their program went along with it, and now new cases of teen pregnancy and HIV are currently on the rise. That's next.
Ever since I joined the program, I learned sisterhood, like be there for my sister, be friends with my sister.
The young ladies and staff at Stepping Stones International tell me the DREAMS program was making a real impact, keeping young girls empowered, informed, and away from older men that could potentially take advantage of them. But when USAID folded, their program went along with it, and now cases of teen pregnancy and HIV infections are now on the rise.
Ever since the program stopped, there have been quite a lot of cases about teenage pregnancies at schools.
As countries agree to limited global health support, NGOs are trying to figure out how to do more with little, or in some cases, nothing at all. This next story taking us to the capital of Botswana. At about 6 o'clock this morning, I hopped on a flight from Johannesburg, South Africa to make my way to the capital city in Botswana. After about a 30-minute drive, I arrived at Stepping Stones International. This is an NGO here in Botswana that works with young boys, young girls, teaching them life skills, providing training, and really a safe space to ensure that they are productive, that they are healthy, and also helping them work through traumatic situations.
So here is our counseling rooms.
Beauty Magosha is the program director.
We use a holistic program where we engage the young people themselves, the children and youth, their families and the communities that we work with, ensuring that we empower them with life skills, with psychosocial support, and support them with their education.
The campus of Stepping Stones International was buzzing during our visit. Students huddled in groups, others helping with food delivery on campus, and staff preparing meals. It was alive.
So they come with a lot of traumatic challenges that impede them to be empowered and to grow. So with the provision of the first entrance in our program in psychosocial support so that we can engage. And we find that most of our children have suicidal ideations, have a lot of anger, are dealing with grief that have never been addressed before. So they find themselves not knowing exactly what to do.
For years, Stepping Stones International has helped vulnerable children, young women, and young men with personal enrichment, HIV testing, prevention services, and trauma support. Then, 2 years into a $7 million USAID-backed contract, that funding was cut off without notice. Secretary of State Marco Rubio posting on X in March of 2025 that 83% of USAID contracts were canceled because they spent tens of billions of dollars in ways that did not serve and in some cases even harmed the core national interests of the United States. Stepping Stones was implementing PEPFAR, the president's emergency plan for AIDS relief, which launched under President George W. Bush.
We were implementing PEPFAR USAID project in 8 sites in the district where we were providing orphan and OVC program for the orphan and vulnerable children. We're implementing DREAMS program for the adolescent and young women. We were also doing community HIV testing and support for people living with HIV and also providing preventive services to the people that are HIV negative.
To lose that money, that's a huge blow.
It is. It is a huge blow to the beneficiaries because also we didn't have time to prepare our beneficiaries of our exist. So we just left them like that.
The World Health Organization lists Botswana as a high-burden country for its prevalence of HIV. 15.7% of adults here are HIV positive, but considerable progress has been made, decreasing the mother-to-child HIV transmission to about 1% and surpassing key United Nations HIV benchmarks for testing, treatment, and viral suppression in 2022. The fear now is that without funds, progress could be reversed. Kennedy Mumpele is the executive director for the Center for Youth Hope, which cares for young people living with HIV and AIDS.
We just need to see how we can do this because, it's difficult to gain these strides like Botswana did. It will be very painful if we slide back.
Botswana has signed a new 3-year health agreement with the U.S. State Department worth nearly $500 million. The U.S. will contribute $106 million. Botswana will put up the rest. The State Department says that the goal is to sustain progress beyond Botswana's HIV targets. But the agreement does not replace all the USAID money groups like Stepping Stones lost when their contracts were canceled in early 2025.
Kind of an amazing story.
Dr. Jennifer Cates is Senior Vice President and Director of the Global and Public Policy Program at KFF.
The U.S. has been quite generous giving funding to countries. What's being asked of countries? And should there be some kind of co-investment requirement, which frankly is done by many other global health institutions. What's happened over time is what started as an emergency program in 2003 and was meant to stave off a major crisis on the continent of Africa, became part of like the way many countries were responding to their healthcare system. And at some point, and maybe in the last 5 years or longer, there have been increasing discussions about what's the end game here? How long will the U.S. be doing this? And I think good questions. Should the U.S. do this in perpetuity?
Newly released State Department data shows what experts say are some warning signs since the USAID funding cancellations, with noted declines in global HIV testing, diagnosis, and prevention services.
If I had to hypothesize, it's hard to see how everything that happened last year and these ongoing changes are not going to negatively impact HIV outcomes. Will it be a catastrophe? I'm not going to say that. There were some predictions that it would be, but it's hard to see how it won't have a negative impact.
A spokesperson for the State Department told us that there are no plans to sunset PEPFAR, and they remain committed to responsible stewardship of the program. But in this new reality, many NGOs are left to figure out how to fill the gaps and and avoid the dangers that may lie ahead without support from USAID.
I will not throw away the great work that was done in the past. I think even for us as an organization, the good systems, the quality implementation most of that support, we got it from USAID to be where we are.
There were also questions about how global health funds are being spent. Reporting from our partners at CNN suggests that the Trump administration is looking to divert $2 billion in global health funding to pay for the cost of shutting down USAID. Now, the State Department did respond to our questions, but several weeks before this report, telling me that the department will continue working with Congress to implement appropriated funds consistent with the law and President Trump's America First global health strategy. Well, Dr. KG Sung is a drug-resistant TB expert, outbreak investigator, and HIV physician. He says that only a small amount of money allocated and obligated for global health programs by Congress is actually being spent. And he says that it's raising concerns. Doc, I wanted to sort of get your assessment about where PEPFAR funding stands now. You know, based on what you publish, there seems to be some real concerns that you have about sort of the implementation of, well, first of all, the transfer of money from the State Department to the CDC, and then two, how that money is now getting to clinics, NGOs, and other organizations that depend on it for them to deliver appropriate care to those that need it.
Yeah, and it's not so much about the total amount of money, right?
Mhm.
Because we know that Congress has appropriated the same amount of global health money that it did last year in 2025, that it did the year in 2024. And that's because all of global health is really important to Congress, and certainly HIV/AIDS health money, which is PEPFAR. So that has remained completely constant. So it's really about how that money is being spent. And that is what is just incredibly confusing. You know, the State Department, which is responsible for all of it, is not been very transparent. And we don't know, is that intentional or is it actually just real confusion on their side too? They may also not really know exactly what the plan is or what they should be doing. But yeah, I mean, just from stepping back a bit, I think that has caused a lot of confusion on the ground with all of these NGOs that have been working to provide HIV/AIDS care. And I think you're going to see that in Botswana, South Africa, all these countries. I think they will all report that it's a lot more confusing than it has been in the past.
There is reporting that suggests that the administration is sort of leveraging PEPFAR funding as a means of trying to get access, either intellectual or even physical access to some of these countries, maybe in the way of mineral rights or in the way of data that previously wasn't required under last sort of memorandums of understanding. What is your understanding of that situation itself and sort of the implications as a result of that?
Right. So I think that the old model was that global health, when you're trying to treat people with deadly diseases like HIV, that's just not supposed to be political. It's complete. It was really put in its own track, and really that was one of the reasons, I think, one of the rationale for USAID being a different agency. It was obviously part of the State Department, but it was kind of doing its own thing. But now I think all bets are off, right? They've destroyed that platform partially. Like they dismantled USAID. It looks like they're trying to dismantle CDC, the CDC portion of that global health platform. They haven't done it yet, but I think I can guess that's partly that it's the same sort of intention to destroy what went on before, and we're going to create something new. And I think that the reporting has been very, very accurate. They're trying to figure out what the new way of doing global health is going to be. And they are trying to they're trying to negotiate with all of these different governments. It has been very clear, that it is transactional. And the Zambia contract that was just signed, yeah, it was just very, very clear This needs, and it's there in black and white in the MOU that mineral rights is on the table, and that needs to be clarified before the global health money can flow. So I think the reporting, no matter what the State Department is saying or denying, I don't know. I mean, it's right there in black and white in this contract that they're negotiating and that are being signed.
And for you, and based on the research that you've conducted thus far and your analysis, what sort of risk does this pose to those countries that are still grappling with trying to control and even help prevent new cases of HIV?
Yeah. Well, when you have disruptions like this, for example, I think the piece that I wrote was specifically about the CDC part of PEPFAR, but that was only one half. The other half was the USAID half, and that was completely dismantled. So whenever you have a major disruption like that, when you just terminate all the funding flows to all of these small NGOs, some of them American NGOs, but a lot of them African NGOs, they have to shut down. They have to stop their activities. They have to lay off people. They have to look for funding elsewhere, and it may not come. And even if it comes, it's hard to hire those people back that you just fired. So this really does end up, in healthcare, if you can't just stop providing healthcare in a clinic for a day or a week or a month, you are not providing life-saving services, and that ends up hurting people's health and resulting in some deaths.
So after hearing from the organizations, the workers, the clients, students, and the researchers, even government officials, you now have a better picture of the impact of the closure of USAID on global health, NGOs around the world, and why the Trump administration says that this new direction is necessary. Whether or not it's good or bad, only time will tell. But what is clear is that organizations and generous donors are doing their best to fill the gaps despite the changes, and the Trump administration is ensuring that countries funnel more money into their healthcare infrastructure. This project would not have been possible without the Pulitzer Center, so we thank them for their support. And we thank you for watching Aid Interrupted. I'm Larry Miller. We'll see you later.